Okay. Hi, my name is Ninki Darrell, and today I'll be doing a presentation on periodontal disease, the quiet erosion of confidence. So, what is periodontal disease? Periodontal disease or periodontitis is the inflammation and infection of the tissues and bone that support your teeth. Periodontitis is painless and silent in the onset and can affect people of all ages. Some risk factors include smoking, stress, poor oral hygiene, diabetes, and poor diet. It's estimated that 42% of Americans with teeth over the age of 30 have some form of periodontal disease, and 7.8% have a severe case. So the progression of periodontitis, it starts as gingivitis. Gingivitis indications are puffy gums, bleedy gums, pain when flossing. But gingivitis is reversible, thankfully. As gingivitis progresses into periodontitis, you may notice bad breath, tartar buildup around the gum line, and gum recession. When gingivitis moves into periodontitis and then becomes a severe case, you may notice loose and shifting teeth, pain when eating, a bad taste in your mouth, and pus along the gum lines, accompanied with the tartar buildup at this point. You may see pus, and bad breath at this point will be chronic in most cases. So basically, one of the main things with periodontitis disease is, as mentioned earlier, with the accumulation of tartar around the gum line, that bacteria begins to push the bone down and create pockets around the gum line between the tooth and the bone. These pockets are unable to be cleaned with regular flossing and brushing because they're subgingival. So the bacteria just begins to flourish and creates deeper pockets, creating more bone loss. And without proper care from a dentist or hygienist, this can end up in not a good like it can be very bad. Very, very bad. Okay. Um, so basically, the formation of plaque starts. We brush our teeth, and then immediately acquired pellicle begins to flood our mouths from our salivary glands. At the same time, the epithelial cells from the gingiva are shedding, and bacteria from food and just, the mouth in general, it all culminates together around the gum line. Now, normally at this point, we would floss, brush our teeth, do our regular oral hygiene routine, and then this bacteria would be removed, and then the cycle would continue with acquired pellicle, bacteria removal, and so on. However, if this bacteria isn't removed, it will begin to thicken. And once the bacteria thickens, the plaque now turns into biofilm and it begins to stick to the teeth. It's not able to be removed as easily with brushing and flossing at this point. It can be done, but it just takes a little bit more. Now, at this point, the plaque is stuck on the teeth. When it turns into biofilm and it's left there for more than about 3 to 7 days, it begins to harden and thicken. At this point, it can't be removed with regular brushing and flossing. You would have to see your dental health care provider or a hygienist, whoever that may be, so they can go ahead and remove the plaque before it begins to turn into calculus. Now, how this thickened plaque turns into calculus, basically, phosphate and calcium ions in the biofilm move down their concentration gradient into the sticky plaque that can't be removed from your teeth. As the ions in the teeth multiply and multiply, they hit a point which would be called stable enucleation. And each site, or these stable nucleation sites in and around the gum line in this in this hard, firm plaque that can't be removed from your teeth, it will begin to calcify. And once calcification occurs, that's when plaque begins to turn into calculus or tartar. And then once plaque is then tartar on your teeth, it absolutely cannot be removed. And it just creates an even favorable environment for more tartar and more biofilm to accumulate in the area because of its formation and rigidity. Okay. And then right here, I just have a little infographic basically showing the remineralization of plaque. Okay, so this is my favorite part. So right here, as you see, this is gingivitis. You can see indications right here, very puffy gums, redness, especially right here in the lower anterior area. But as I said, with proper flossing and brushing, this can be reversed. Also, it is very important to see your it's also very important to stay on top of your 6 month or 4 month, however your hygienist recommends you to get cleanings. It's very important to stay on top of these cleanings so they can go in subgingially and keep that area free of bacteria, or at least as low as it can possibly be. But this is gingivitis right here. Okay, so then moving into this area right here, this is when we start to see, a moderate case of periodontal disease. You can tell immediately the recession is very, very drastic from here to there. Even indications of bone loss, you can't necessarily see the full lower gingiva right here, but you can just see the difference with more of tooth showing right here. And of course, you do see the infection starting to seep below the gum line right here. Um, Again, purplish, bluish gums right here. This is showing the infection is really rampant. Right here, the gums, they aren't as purple and bluish, but you can tell the purple and the blue, the color change right here shows just progression of the periodontitis. Moving on, we have a more advanced case. Not as much bacteria on the teeth. No pus on the teeth as well. You still see, a little bit of calculus buildup, but in this case, it's just rampant bone loss, especially in the lower anteriors. Again, you can begin to see the full cervical third of the tooth right here compared to the more moderate case. Yes, you begin to see tooth root surface right here, but it's basically all covered up. In this case, you can see the full cervical third of the tooth. The patient has attrition. Even right here on what is this? Number 19 right here, you see root surfaces. I wish I could kind of zoom in more, but hey. Okay. And then finally, a very, very advanced case of periodontitis. Basically, full root surface is observed in the teeth. The patient is very well on top of their home care, and that's the thing. Once you get all the bacteria out and there isn't necessarily active infection going on, these pockets still need to be treated to prevent the continual erosion of bone. So that's why it's important to make sure that you stay going to the dentist every 6 months. So the progression of the disease can be caught at maybe a stage like 1 and 2 as opposed to 3. So why should you care? Why should anybody care about any of this? So basically, as mentioned before, this disease is very slow and very silent. It's easy to get caught up with work, kids, bills, day-to-day life, other health issues, that may be causing you ailment. But I'm basically making this PSA, as you will, to drive home the importance of preventative care and home care. Um, Dental work in general can be very expensive, and the insurance for it isn't the best. However, something that my boss always says is prevention is the best treatment. And I definitely agree with that. Staying on top of your 6 or 4 month cleanings can be something that can help save tons of money and tons of stress in the future when it comes to your oral health. Any problems with whether it's occlusion, gum health, or anything of that sort can be caught in the early stages and be managed. So everything can be, all treatment can just be way more minimal and less invasive. Once you start moving into severe, moderate periodontitis, that's when things start to get more invasive, more expensive, and more stressful for the patient. Um, this is also another reason why I preach x-rays. You can go and get your cleanings done, but a lot of patients, they don't like x-rays. And I think x-rays are very important so you can keep track of that bone height, especially if you are prone to, or if you're predisposed to having periodontal disease. It's very important to stay on top of your x-rays so your dentist and hygienist can constantly monitor those bone levels. And along with staying on top of your x-rays, it's very important to stay on top of your probing depths. If you are concerned about your periodontal or oral health in general, it is important to go to a dentist who probes your teeth and does full oral examinations every time you go to the dentist. Um, yeah, and that's about it. I want to say thank you for listening to my presentation about periodontal disease. I hope you learned something. And yes, thank you so much. Thank you, Professor F, for teaching my class. I had a very, very fun time in biology. Have a great evening. Now, how do I figure out how to turn this off?